On your health tonight, and the state's checklist for childhood shots. Well, certain vaccinations, your kid may not be able to start school. I'm sorry, we're talking about starting school. We're only in the heat of summer, right?
Gosh.
And we're talking about, but you may not be able to start school, which is in about 6 weeks down the road, but it's inevitable. So here to explain is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Dr. Moffitt, it's always great to see you.
Good to see you too.
All right, so of course you are very familiar with the list. What is required for the little ones, the kindergartners?
Yeah, so for incoming kindergartners in Massachusetts, it's really 5 vaccines that will be required. And those include a vaccine that's a combo vaccine for diphtheria, tetanus, and pertussis. Another would be for polio. The other would be the hepatitis vaccines, as well as the MMR, or measles, mumps, and rubella vaccine, and then the varicella or chickenpox vaccines. So those are the 5 big ones required for Massachusetts kindergarten entry.
And Doctor, right in the middle of that, the MMR, the measles, you mentioned the measles. Other states have seen record outbreaks this year, but Massachusetts hasn't seen a single case. Do you think it's only a matter of time before we do see one?
It's a really good question, one that lots of public health individuals in Massachusetts are pondering and keeping a close eye on, but I think it's a bit hard to say. Indeed, in Massachusetts, we have very good overall rates of immunization coverage, but if you really drill down into specific counties and then some towns within those counties, there actually is quite a bit of variability. We also know that 90% of people without immunity against measles will become infected with measles if they're exposed to a person with measles. And we also know that a community needs to maintain at least 95% immunity or vaccine coverage in order to prevent an outbreak. So it's certainly conceivable that in some of those counties and schools that are below that 95% vaccine coverage rate, if measles were introduced in that setting, measles could spread very easily to non-immune people within that setting, and we could see an outbreak in that way.
Got it.
Well, good to know. And Dr. Moffitt, college students typically start classes a little earlier. Are there any shots that they should be getting before they go back to school?
Yeah, that's another great question. I would suggest first and foremost that incoming college students and their families be in touch with the college the student is going to. If the college has not already reached out to them, a lot of colleges will start that process early. The required vaccines for colleges in Massachusetts, for the most part, overlap quite a bit with the kindergarten ones. So definitely MMR, varicella, and the hepatitis B vaccines. Additionally, colleges in Massachusetts will look to see that incoming students have had a tetanus booster within the last 10 years. And then very unique to college, the incoming students will be strongly recommended to receive, if not required, to receive a meningococcal vaccine. And that is because there is a uniquely increased rate of meningococcal meningitis, particularly among college students living in dormitories. And that's a very serious infection.
So you said recommended but not required, right?
It's going to depend on the school. It's a little hard to say, but very strongly recommended, if not required.
Great, Dr. Moffitt. Thank you so much. Great to see you.
Good to see you too.